Okay, so what did you guys think about, did you guys learn anything new from the video that you didn't know?
Just how the HIV and AIDS and whatever, it goes up and down throughout history in each country, and it's a little different in not just within the country, but within different areas and within the different people, whether they're in a more urban area or more rural.
Yeah, I thought that was really interesting. I thought it was good that he made the analogy. I've lived in 2 different places in the United States, and they're very, very different. And so I thought that was really cool. I also thought, what did he say that was so interesting? I thought it was interesting that and good that he made mention. He goes, the things that we're doing right now are good. It's good that they're being done, but obviously that we can improve on them. But he wasn't critical of what was being done right now. He mentioned that it was a good thing, and I thought that was really important because I think a lot of times when we look at these big social issues, it's a lot of attacking, it's a lot of finger pointing, it's people. Sorry, I'm kind of looking around. It's a lot of people trying. They don't acknowledge what's already been done. That's good. So,
You boys?
I thought it was interesting that, it's not necessarily just the little poor countries that have really high populations. Their percentages is higher, but the U.S. had more people that actually have AIDS. So it was the countries that are more wealthy that have more people with AIDS. I don't know if it's because drug use and they can afford drugs and stuff, or prostitution or whatever, but the fact that the countries with the higher wealth had higher populations, I thought was kind of interesting.
yeah, definitely, and I think that's very valid because I think a lot of people have a really big misconception of how what the numbers actually look like, and probably don't realize how real it is with where they live.
So it's not war-ridden countries that have the high percentages. It's not necessarily the poor countries. So what countries are the highest?
I think a lot of those rural countries, it's still them, but I think it's hard to compare because I think people are looking at it as geographically, how big the population is.
Yeah.
But populations are just so different with, we've been talking this semester about living conditions, and, I think it would probably be fair to say that cultures and living conditions, even some places in the United States, could be compared to really rural places in Africa as far as cleanliness, culture, different practices. I don't know. What do you guys think about that?
Yeah.
Is it access to HIV testing? Is it education? What's the?
I think like he said, it's a lack of birth control. I think is the biggest issue.
Yeah, so I was thinking medical. Some countries have better access to it, and they have the money to do whatever they need to prevent it or help treat it.
Yeah. Do you think that if some of these rural places, and even I guess places in the United States, if birth control is the issue, or protection, or healthcare, what do you think needs to be done? Do you think that introducing what we in America practice is to be, I guess, normal precautions, do you think that people would accept those precautions, or do you think that it would help very much, or do you think that they would be unwilling to try those methods, I guess? Does that make sense?
Well, it'll take time to try and influence these other countries, but we can start on our own and, educating those within our country, especially in those areas that, it's really affecting the population, and start there, and then we can build out to these other countries, and, we can partner with these other big powers of the world and help out.
We wiped out smallpox somehow.
Get rid of AIDS.
I think they can do it. I think they can. Hopefully. I hope so.
I hope there's a second coming. I'll take care of it.
Oh
Yeah,
yeah,
that's
let's wait
true.
for that.
Well,
Second
like-
coming's gonna fix it all.
The guy in the movie says like, yeah, we can use our hearts and we can use our wallets, but we need to use our brains. So maybe education and a worldwide effort. I don't know how they did it, but smallpox is no longer a problem.
That's
Nobody
true.
nobody gets vaccinations for it, and nobody gets it anymore.
No, I think that's a very good point. And I like that you mentioned what he said at the end of his discussion about, you know, you can pull out your wallet and donate money, but we know, especially learning about education, I really liked some of these other videos that we watched on TED. They mentioned, you know, some of the most brilliant people in the world are found in the most obscure corners of the planet. And so if we can get people more educated and more excited and more involved, more passionate about helping heal the world, I guess, in a sense, I think you're right. I think that they can do it.
Like some of these universities, they educate, but then after they educate their students, sometimes they'll give their students like these research grants and professors, and they'll research it.
Yeah.
So I guess it all boils down to education.
Education's the key. Start there. Or wait for the second coming.
I'd
Whichever
say
comes
so.
sooner.
Do you guys have anything else to add?
No. Good video.
All right.